Hello and welcome to iStream Ophthalmology, learning ophthalmology made simple by Dr. K. Suresh. Today, let's learn about the basics of hypermetropia. So, what is hypermetropia? Hypermetropia is a condition where parallel rays of light gets focused behind the retina and not on the retina. Because of this, patients find it difficult to see near objects. Hence, it is also known as long-sightedness or hyperopia. Why is this happening? Why is the eye finding it difficult to focus the rays on the retina? This is because the hypermetropic eye is considered as a weak eye. The main function of all these structures in the anterior segment, namely the cornea and the lens, are to focus the light on the retina. When the converging power of the cornea or the lens, or there is any discrepancy in the location of these structures, cause a decrease in the converging power of the eye, it leads to what is known as a hypermetropic eye. Before going into the dynamics of hypermetropia, let's see what are the contributions of each structure in the anterior segment towards normal refraction in the eye. From the table given, you can see that the cornea contributes around 40 to 45 diopters of convergence power of the total optical power of the eye, which is 60 diopters. The lens contributes around 15 to 20 diopters of convergence, and this happens when the anterior chamber depth is ideally 3 to 3.5 millimeters and the axial length is 24 millimeters in length. Why these values are important is if there is a change in any of these values, it can drastically affect the refractive power of the normal eye. In the previous slide, we saw how the different parameters affect refraction in the normal eye. Now, let's see what happens if one of these parameters is disturbed. To start with, let's take axial length. Let's imagine a situation where the total refractive power of the eye is normal, but the axial length is small. So what happens? Because of the normal refractive power, the lines or the rays of light are converged at a fixed distance. But since the eyeball is small, this convergence happens behind the eyeball, leading to what is known as a axial hypermetropia. 1 millimeter of shortening of the axial length in the eye results in approximately 3 diopters of hypermetropia. Such a condition can be physiological because at birth the eyeball is small, or pathological when there is a tumor which is pressing the eye from behind, or some inflammation causing shortening of the eyeball. Such a condition where the axial length is shortened and hypermetropia occurs is known as axial hypermetropia. Now let's look at the next parameter and the most important parameter, the cornea, which contributes to 40 to 45 diopters of refractive power of a normal eye. Now let's imagine a situation where the cornea is relatively flat. This causes a gross decrease in the convergence power of the eye. A 1 millimeter change in the radius of curvature results in approximately 6 diopters of hypermetropia. So any disease that causes a flattening of the cornea leads to what is known as a curvatural or curvature hypermetropia. The next significant contributor to the refractive power of a normal eye is the lens. Any change in the refractive index of the lens can cause a decrease in the converging power of the lens, leading to hypermetropia. Such a hypermetropia is known as index hypermetropia. This can be physiological as in old age, where the lens becomes more stiff and loses its power to accommodate or change in shape, leading to loss of converging power. Or sometimes it can be a pathological reason like diabetes, where because of accumulation of byproducts of diabetes, the patient loses their ability to converge the parallel rays. This is known as index hypermetropia. We just saw how a change in the refractive index of the lens can lead to hypermetropia. But sometimes the refractive power of the lens might be perfectly normal, but the lens might be abnormally placed, like a posteriorly dislocated lens, either congenital or acquired, as in the case of trauma. Here, the lens converges the parallel rays well behind the retina, leading to hypermetropia. Such a reason where hypermetropia happens because of malposition of the lens is known as positional hypermetropia. We have already seen that a lens contributes to about 15 to 20 diopters of convergence power of a normal eye. Now, if a situation arises leading to absence of the lens or aphakia, either as a result of a complicated cataract surgery or trauma, then this 15 diopters of convergence power of the eye is lost, leading to secondary hypermetropia. Other causes of secondary hypermetropia could be because of a overcorrected myopia or placement of an incorrect IOL, leading to consecutive hypermetropia. These are other causes of secondary hypermetropia. Till now, we saw different types of hypermetropia, maybe axial, curvature, physiological, positional. All these types of hypermetropia can occur congenitally. Like axial myopia can happen in a case of microphthalmos. A change in the curvature can happen in cornea plana. Positional hypermetropia can happen because of ectopia lentis. These are all causes of congenital hypermetropia.